Indications for chemotherapy in breast cancer. Positive lane, locally advanced BC, PR negative, HER2 NOI positive, metastasis. Indications for neoadjuvant chemotherapy in breast cancer. 1. Locally advanced BC. 2. Triple negative BC. 3. HER2 NOI positive. 4. Large tumor but point want BCS. Advantages of neoadjuvant chemotherapy in BC. Decrease size of tumor. Decrease micrometastasis. What's RECIST criteria? It's a response criteria in solid tumors. Basically way to evaluate the response of a tumor to my treatment modality. Criteria and features in RECIST criteria. 1. CR/PCR, complete response or pathological complete response. 2. PR, partial response. 3. SD, stable disease. 4. PD, progressive disease. CR or PCR in RECIST criteria means. It means following chemotherapy, all lesion and pathological lane disappear. PR in RECIST criteria mean 1. 30% decrease in single largest diameter. 2. No new lesion. 3. No progression of non-target lesions. SD in RECIST criteria means no PR or PD. PD in RECIST criteria mean 1. Greater than 20% increase in single largest diameter. 2. Progression of non-target lesions. 3. New lesions. How are chemo drugs given? Via chemoport, it's placed just below clavicle, in SVC, above right atrium. Advantage, prevent thrombophlebitis. When is chemotherapy avoided? 1. If poor performance status. 2. If T1 T2, N0 N1, M0 PR positive, M0 positive PR negative, ER/PR plus HER2 NOI negative. In these, do molecular test and if low results, then avoid chemo. Performance status are measured by what scales? Karnofsky scale, ECOG scale. Molecular tests denotes what? Risk of recurrence. Molecular tests names. Oncotype, Mammaprint, Endopredict, PAM50, can assist. Which molecular test is a Indian test? Can assist. Oncotype molecular test has how many genes assay? 21 gene assay. Mammaprint molecular test has how many genes assay? 70. Endopredict molecular test has how many genes assay? 12. Indications for radiotherapy in breast cancer. Positive lane, tumor size greater than 5 cm. Locally advanced tumor, after BCS. Types of radiotherapy in breast cancer. 1. WBI, whole breast irradiation. 2. APBI, accelerated partial breast irradiation. Indication for ABPI. T1, PR positive, no lymphovascular invasion, unifocal, negative margins, age greater than 50. Indication for hormonal therapy in breast cancer. Either or both are PR positive. Hormonal therapy in premenopausal woman, drug, time and side effects. Drug tamoxifen, SERM, duration 5 years, side effect, hot flashes, endometrium hyperplasia, DVT. Hormonal therapy in postmenopausal woman, drug, time and side effects. Letrozole, anastrozole aromatase inhibitor. 5 to 10 year, SE, osteoporosis. Before starting aromatase inhibitor, what test need to be done? Baseline DEXA test. If low, give supplements of D3, calcium, bisphosphonates to avoid osteoporosis. Most common side effect of tamoxifen in premenopausal woman, on hormonal therapy. Hot flushes. If a woman plan pregnancy while on tamoxifen during breast cancer, what are guidelines? Avoid pregnancy for 2 years, means tamoxifen has to be taken completely for 2 years. If she wanna conceive after 2 years, tamoxifen has to be stopped 3 months prior to conception. Most important prognostic factors in breast cancer and in metastatic breast cancer. In BC, axillary lane status. In metastatic, ER-PR status. Which histopathological variant of breast cancer has poor prognosis? HER2 Neu positive, triple negative, lymphovascular invasion, DCIS component, high Ki67 index. Which among two has poorer prognosis in breast cancer, premenopausal or postmenopausal? Premenopausal, cause they have two sources of estrogen, one ovary and other peripheral conversion of fat. Follow-up after surgery or treatment in breast cancer. Every 3 months for first 2 years. Every 6 months for 2 to 5 year. Every year after 5 years. Follow-up after surgery or treatment in breast cancer, examinations. 1. Physical examination in every visit. 2. Mammogram or USG once a year. 3. Patient on tamoxifen, USG pelvis to see endometrium thickness. What is early breast cancer? T1, T2, N0, N1, M0. Treatment for early breast cancer. Surgery, BCS, if NORPR, SLNB. Chemo as said earlier. Radio after BCS, if lane plus. Hormonal if ER-PR plus. What's LABC? Locally advanced BC, T3N1M0, any T4M0, any N2M0, any N3M0. Treatment for LABC. Neoadjuvant chemotherapy, surgery BCS or mastectomy RT. Hormonal if ER-PR plus. If HER2 Neu positive, trastuzumab. Metastatic breast cancer treatment, if ER-PR plus HER. Hormonal therapy, AFT resistance development, give CDK4/6 inhibitor. Palbociclib, ribociclib, abemaciclib, if resistance develop, do chemo, Zoladex or fulvestrant. Metastatic breast cancer treatment, if TNBC. Chemo plus, PD-L1 inhibitor, pembrolizumab AB, atezolizumab. Metastatic breast cancer treatment, HER2 Neu positive. Chemo, trastuzumab, if resistance, oral anti-HER2 Neu lapatinib, or IV anti-HER2 Neu TDM1. Among lamtinib and TDM1, which one cross BBB, so used in brain metastasis? Lapatinib. Pregnancy-associated breast cancer, what's it? Breast cancer during pregnancy or 1 year of delivery. Features of pregnancy-associated breast cancer. ER-PR negative, aggressive tumors. Management of pregnancy-associated breast cancer. Surgery, mastectomy in first T. BCS in second third T. Chemo, CI in 1 STT, safe in other. HTRT, CI in all trimester. Male breast cancer risk factor. BRCA2 greater than 1. Obesity, Klinefelter, alcohol intake, liver cirrhosis. Management of DCIS. Simple mastectomy or BCS followed by RT. No role of chemo, hormonal therapy if ER-PR plus. What score predict the risk of local recurrence in patients with ductal carcinoma in situ DCIS of the breast after surgery? Van Nuys Prognostic Index. Van Nuys Prognostic Index parameters. Size, margins, grade, necrosis, age. ER-PR not included. Management of lobular carcinoma in situ. Point is kept under surveillance, if progresses then managed.